In a previous video, we considered differences between blood vessels. We considered the structure, function, location of arteries, capillaries, and veins. In this video, I'd like to return to the topic of blood vessels and consider some other differences between them. If we look at it this way, if this is the heart delivers blood to the arteries, arteries to arterioles, remember those are the small blood vessels, small arteries, capillaries, venules, which are the small veins, delivering it to the veins and then back to the heart. So this primarily, we're thinking more of the systemic circuit here. This is the left atrium, left ventricle, and the right atrium over here. The differences I'd like to consider in this video are differences in terms of blood pressure, the speed at which the blood is traveling, and the surface area of the blood vessels as it's going through the body. This is the beginning of a graph, and I can't put any numbers on here. All I can do really is represent this as being higher and this being lower. Because if we're dealing with blood pressure, the units here would be millimeters of mercury. If we're dealing with speed, we'd be dealing with maybe centimeters per second. If we're dealing with surface area, it'd be, maybe surface millimeters squared per whatever. It's just, you can't put numbers down here. What I'd like to consider first is the blood pressure. When blood pressure leaves the heart, it's a lot higher than it is when it gets back to the heart. We've already mentioned that. When blood pressure is in the arteries, and maybe you consider the brachial artery, we say blood pressure is like 120/80. When it leaves the heart, it's slightly higher than that even, because it's right next to the heart. So blood pressure variable might look something like this. As the heart beats, and as it gets further away from the heart, the blood pressure decreases and decreases, and the difference between systolic and diastolic, the higher pressure and the lower pressure reading, also decreases. So by the time we get down to the capillaries, as we said before, the blood pressure entering the capillaries is quite low, and it continues to decrease. And notice it continues to decrease all the way back to the heart. Just to put a couple labels on here, this could be a systolic pressure. This would be a diastolic pressure. So there's the heart, the blood pressure beating as the heart beats. As it gets further from the heart, the difference between systolic and diastolic decreases. We said before, when it gets to the beginning of a capillary bed, it might be about 35 millimeters of mercury. When it gets out of a capillary bed, it might be something like 15 millimeters of mercury. And when it gets back to the heart, it's continued to decrease. It's practically nothing. As a matter of fact, at some times it might be 0, and as the valves from the right atrium open, allowing blood to get into the right ventricle, sometimes there's almost a vacuum type effect, and there's the blood vacates the atrium, and it might even be slightly negative, so it's sucking the blood into the atrium. So that's the difference in blood pressure as we go from heart back to the heart. In terms of speed, the speed of the blood also changes. You can imagine where there's more pressure, there's going to be more speed. So what happens with speed, and I'll use red for speed, and again, this being a relative scale, it doesn't really matter where I start putting the red. I'm going to put it right here. As we're leaving the heart, the speed of the blood matches the pulsating effect of blood pressure. So it's moving, it's moving, it's moving, it's moving as it's pulsating through the blood vessels. But again, as we get closer to the capillaries, that difference in pulsation diminishes, so that when we get into the capillaries, there isn't any real change in the speed. It's sort of just flowing quite slowly through. And when we get out of the capillaries, where blood pressure is 15, we're in the veins, and the blood in the veins can actually, the speed of the blood can actually go up slightly as the skeletal muscles are forcing it back into back towards the heart. So I'll just leave it like that. The third component of this topic today is how the cross-sectional area changes. If we think about the heart, we're dealing with the systemic circuit, we have only the aorta here. It's the big blood vessel. So the cross-sectional area of that, if we take a look at the topic, if this is a look into the aorta, we're talking about how much surface area there is as it's leaving the heart. And that's not much, because we're only dealing with one blood vessel. So it starts out quite low in terms of surface area. As this blood vessel branches, if you take the same volume of blood and split it up over two blood vessels, wherever they are, the surface area is increased. So as the blood travels away from the heart, as the blood vessels branch and branch and branch and branch, it goes up. So we get an increasing amount of surface area the further away from the heart we get. But as we get to the capillaries, remember the capillary bed that we had, this network of tiny blood vessels, the blood pressure, the cross-sectional surface area, the surface area goes like this. Huge surface area in capillaries. And of course, when we get to the venule side of the capillaries, that goes down. To be a little bit careful here, because I want to make sure that this is lower than this. Because when we get back, if you remember, we have an inferior vena cava and a superior vena cava, both taking blood into the right atrium. So there's two blood vessels returning it where there's only one blood vessel taking it out. So this is really significant because it's through the surface area of the capillaries that all the exchanges of materials take place. Capillary fluid exchange topic, where the nutrients are being delivered, the oxygen is being delivered, and the wastes are being brought back in. The blood is going very slowly. It's got lots of surface, lots of time for exchange. It's maximizing that feature. One last little tiny bit before we leave this topic, and it has to do with arterioles, and it has to do with the end of the arterioles just as they're getting towards the capillary beds. Arterioles are equipped with sphincter muscles. Sphincter muscles we saw in the digestive system that control the movement of the food through the food substances through the digestive system. The same thing here. These sphincter muscles control the movement of blood into capillary beds. The reason for that is there are times when a capillary bed may not be getting, on purpose, may not be getting the right amount or the full amount of blood, or it may be getting more blood than normal. That topic is coming up in another video, but I want to point out that there are sphincter muscles at the ends of the arterioles before capillary beds. Thank you very much.